So, first of all, happy Doctors' Day to one and all, and thank you, sirs, for giving me this wonderful opportunity. It's like going back to the history of community medicine as such, and then how is it related to COVID. So, it made me think a lot, and then after hearing to a lot of great people, so I'll try to present whatever small I can. So, so this is already told. Hygia was the Greek goddess of health, cleanliness, as well as hygiene, and her name is the source of the word hygiene. And she was associated not only with prevention of sickness and also, but also continuation of good health. That is the healing part. WHO, how it defines hygiene, though it's already told, I'll just try to repeat. It refers to all the conditions and practices that help to maintain health and also prevent the spread of disease. In this context, there was one thing like spread of disease. Is it only with contagious disease or communicable diseases? Maybe we can take like how we are taking the broader concept of the word hygiene. Here also spread can mean the numbers as well as the geographical areas, because initially it was thought the non-communicable diseases were only confined to Western countries. Now we know how much it is in our country, developing countries. So if we see the phases of public health, the initial was a disease control phase. If we see the whole phase of public health only starts from 1900s. So very late when compared to our history, development of medicine in our country. Here the disease control phase is from 1880 to 1920. So this is after the germ theory was propounded. So initially our HOD has often told our department, the Department of Community Medicine, was initially called the Department of Hygiene. So even if you take in Tamil Nadu, the Ministry of Health is called Sugadara Thurai. Sugadaram is the Tamil word for hygiene. So, but here the germ theory, when it was propounded, every disease was only thought to be only communicable disease, and whatever efforts that were taken were to control all those communicable diseases through antibiotic development and other such things. And then came the health promotion phase, that's from 1920 to 1960. So that was the time when Boer committee was constituted in our country, and people tried to start PHCs and sub-centers and take health to the rural and the next level. Then came WHO was formed in between in 1950. Then came the social engineering phase. What and all measures we can take in the society. This also took into effect the man's behavioral aspects. So because the NCDs also started coming up on a big scale in those countries. So the social engineering phase. And then in 1981 came the health for all phase. In 1981, this was propounded, and still the aim is yet to reach. And this is a goal. Then we cannot call it an aim or target. This is a goal. So always humans will want health for all. So, but if you take the literal term, they only want to fill up the gap between the rich and the poor, the developing and the developed nations. Here also, all the indicators are taken as only negative indicators, the indicators of disease, death as such, because still it is very difficult to measure health. As we know, health is a state of complete physical, mental, social well-being, not merely the absence of disease, but still we are measuring disease. Later, the spiritual well-being was also added to the definition. Then it was found not sufficient. Then they told able to lead a socially and economically productive life. Only a man is able to do all these things, healthy on all the four angles, and then also able to lead socially and economically productive health. Then only he was called healthy. So put it in short, sound mind in a sound body, in a sound family, in a sound environment. So here we can also see when sound family, the emotional aspects also come into play, emotional well-being or emotional hygiene, today's topic. So I just wanted to put the different concepts of community medicine into COVID hygiene, how we can see COVID hygiene from the different important basic perspectives. I initially thought like the primary, secondary and tertiary prevention measures, but because Varun sir already spoke, so I don't want to reiterate the same. So if we see, we all know all the concepts in the second year itself we would have studied, but if we see COVID from the iceberg phenomenon of disease, we have a visible portion where people with symptoms come and seek healthcare, and we have a big invisible portion where we have the misdiagnosed, asymptomatic, the contacts, all those patients and those who are susceptible, the children, everyone. So what we can do for the different phases, because hygiene now we have to see not only from the sanitary or the cleanliness aspect, but we have to say take into measure all the aspects that involve a healthful living. So what we can do with this iceberg concept for visible portion, so those who consult a health provider, one thing we all know is to increase the number of testing facilities, and testing has to also reach the primary and the secondary levels, where people have to travel 2 hours to reach a health facility just for testing RT-PCR. So we can take them to the rural and the secondary levels, and then we have to triage patients into test positive and test negative. For this we do have protocols, and then the test positive is being further classified into mild, moderate, severe based upon severe different parameters, and then what are the treatments at the different levels we have. And then for the test negative but symptomatic, yeah, many people are now doing CT scans, and if found positive, there are some protocols available. But for all the test positives, what is very important is per protocol management. In India, it is really sad that there was some protocol given by the government, but it was hardly followed. We all know the mucormycosis, it is even suspected to be because of the illicit or irresponsible, indiscriminate prescription of steroids from day one, or even from asymptomatic or even for test negative patients. I have seen prescriptions. So we have to implement, which is already in policy, per protocol management for those who are positive, to form a have a uniform protocol, and then prompt reporting of all the cases. So even today, people say only 1 on 7 or 1 on 10 is reported, be it disease or be it death with respect to COVID, and then the test being available at all the levels. What are we going to do for the submerged levels? Yes, again, increased testing. Awareness is very important, be it upon the vaccine part or about the social distancing. We can even today see when the lockdown is being loosened, everybody has even removed their mask as if COVID is over. So, better or stricter implementation of the public health measures, the lockdown regulation, and other measures, improving vaccination coverage. Here, we have to match the supply to the demand, and a very important action is required on misinformation, and facilities for quarantine, isolation, etc. Taking us to the next concept, the spectrum of disease. We have seen all this, but again, if we have once more look, because today's topic is hygiene. If you see from here, death, severe illness, mild illness, unrecognized illness, freedom from illness, and then better health. Better health is no illness. So all these six, again and again, we only speak about disease, but we want health in 4 parameters. But when we talk about positive health, how do we measure? We don't have any indicators. It's the subjective feeling that a person has. So he can only feel it, he cannot report it, so we cannot also measure it. But that is the highest end we all aspire for. Here again, the 4 spectrums, how is it like? The mental health being positive and negative, spiritual, to be connected to oneself, and then to the divine, to the nature, however you want to call it. And then the epidemiological triad concepts. We all know the agent host environment triad. When it goes off balance, any of the three, we will get disease. So with respect to COVID, if you see the agent, now it is going for more and more newer strains, the Delta plus strains, which are becoming more virulent, more pathogenic, or more case fatality. And then the host susceptibility. Now we do not know the vaccine efficacy for the newer variants, and still there are a lot of people who are afraid of taking vaccines. So that might alter the host susceptibility part. And then in the environment, we have this lockdown and then unlockdown measures. And then what if the school reopens? What if the public transport opens? So that will change the environment in which the disease can further spread with respect to COVID. So we have to take each one of these concepts when we want to control the disease. Next concept, if we take the chain of transmission. So this link is always, we teach the students to identify the weakest link. But if you take like HIV and all, we affect the mode of transmission, which is just using consistent condom. And then certain diseases like vaccine preventable diseases, we go for susceptible host. That is the weakest link. But with COVID, just like we have for malaria or TB. There is no weakest link. So we are trying to attack all the three links in the transmission. So break wherever possible the chain. For source, though we do not have medicines, we at least have, we know what is quarantine, what is isolation, in which we can prevent the cases from transmitting the disease to others. But still we have the incubation period and then the convalescent transmission might be. And then for the modes of transmission, of course, it's the most difficult because it's a respiratory illness. We are being trying mask, the lockdown, social distancing, all these attack the mode of transmission. And then susceptible host. Vaccination may be called the only measure, but we have spoken all this time on hygiene, the bigger concept. So we have to go back to good nutrition, exercise, fluid intake, and last but not the least, staying positive. More than staying positive, free of fear. So people are so uncertain and fear about the whole episode. We'll have a revisit to history. Excuse me, just a minute. So if you go back to revisit our history, ancient, how the public health evolved. If we see after the germ theory, during the industrial revolution, the public health measures all spoke about this great sanitation.
She disconnected now.
I think there is some connectivity issue. Shall we move on? Dr. Saptarishi? Shriram sir, are you there?
I'm in a different room. I'll just go and find out.
Yes, sir. Sir?
In the meantime, Satya and Mayuri can go ahead with some comments about previous talk.
Okay. So, for me, like how Dr. Om has already mentioned, I mean, the history of hygiene dates back to BC era, or he very well divided it into ancient, medieval, and modern periods. And I think most of you agree with me that our hygiene or our knowledge about hygiene goes back to our grandmother's period, right? So it is our grandmother who taught us, at least for me, the simple basic things about hygiene and all. So in a way, it was all nostalgic for me. And like we should use separate hands for specific purposes, and then we should not enter the kitchen with our slippers or shoes. So those are small things, but they, in the long run, they help us a lot. And if that is what we are practicing now, in the COVID era. And then he very well mentioned, ma'am, are
Ma'am
you
is
there?
back.
Yeah, please
I'm
continue,
sorry.
madam.
I'm
Please
sorry.
continue.
I'm sorry. So if we revisit to the history,
We are unable to see the slides, madam.
yeah, I'll share just a minute. Yes.
I think it is getting connected.
Yes.
No,
No.
no.
Yes, madam, we are able to see. Continue.
Thank you. So if we see again, the word today we are Department of Community Medicine. First, initially I told we were Department of Hygiene. After that, it became Department of Public Health. So this was after the Industrial Revolution. So all the focus was on the different disciplines, the growth of public health as a science. The epidemiologists, they doing their part. Statistics, they came with the surveys, the reports, the statistics, the birth and death reports, and then the sanitary engineers, they tried to improve the public health part. Public health administrators, lawyers, they devising their public health codes, all those things. So everybody played the part, not only the clinicians. In public health, the clinicians were not there, and then the people felt like this is out of our field. So then they changed the word to preventive medicine, where both the word medicine is there, so people felt happy. The doctors, especially, we are also into the group. So this is mainly applied to healthy people. The actions affecting larger number of populations to prevent disease and promote health. So this preventive and social medicine, this was considered inadequate, and then they changed to social medicine. This involved care of patients, the prevention of disease, medical services, establishment of PHCs, and other things as we told. So what are the roles of social factors in the etiology of disease? That was considered during this phase. And then latest, it is community medicine. And now again, this involves, in addition to that, the community diagnosis. What is the prevalence burden for the whole community and how to deliver healthcare? So these two concepts, in addition to training and research. So these are all the additions. Now we are again trying to mingle with public health, and then certain places, even non-medicos do it. We want to have one hold on medicine and then one on the community, on the public health. So this is a clear mixture. And now we want to go back to the original term hygiene, which touches on every aspect of healthful living. So as I just mentioned, so the Department of Health in Tamil Nadu is called Sugadara Thurai. If we go back to ancient Indian wisdom, so we saw how this hygiene concept has evolved over different things and how its application in COVID. So if you see the verse Tirukkural by Thiruvalluvar, it has on the Adhikara medicine, it has 10 couplets. The first one says, Miginum Kurayinum Noisayum Nulor Valimudala Enniye Moondru, which means the three aspects of Vada, Pitta, Kava, which are already mentioned in Ayurveda, the same thing mentioned by Thiruvalluvar also in his Tirukkural. If any one of this is going out of balance, off balance, then the person will go for disease. And another couplet says, Marundana Vendavam Yakkaiku Arundiyadu Attradu Potri Unin, means the person will not require any medicine if he knows what he is eating, the time, the quality, the quantity, and then he eats the next meal only if he is knowing for sure that the previous meal is completely digested. Even 6 couplets in this Adhikaram on medicine, it's touching about only food. So Thiruvalluvar also says food hygiene, especially the eating wholesome food, hygienic food, quantity, quality aspects, all these are covered on the chapter of medicine. So if we concentrate on food hygiene, we can prevent most diseases, including COVID. Tirumular, another yogi or Siddha Purusha, he seems to have lived for 3000 years. This he has himself mentioned. Once in a year, he'll come out of meditation, give one verse, and again go back to meditation. Like that, he has given 3000 couplets. So in which he mentions Udambai Valarkum Ubayamarinde, Udambai Valarten Uira Valartene, which means this body is the tool through which we can attain self-realization, which is the ultimate goal. So if you want to reach your goal, you have to first take care of your body, which is the most important. We have our Patanjali. he talks about Ashtanga Yoga, the last being Samadhi, but the first and second are Yamas and Niyamas. In Yamas, he tells about how and all we can keep our body pure, and then Niyamas, how to keep the negative emotions, the negative feelings away and keep all the positive thoughts within. So inner discipline is Niyama. So don't we think these two, Yamas and Niyamas itself, will lead us to all the physical, mental, emotional, spiritual, all well-being. Spiritual, we'll need all the other six, but for the first three, I think the Yamas and Niyamas itself, they are enough. So this has already been mentioned by Sir before. Bhagavad Gita itself says how to keep the Manasa, Vacha and Kaya. The body, the mind, the speech, all has to be pure for a person to have a positive health, holistic health. This is another thing. This is the book for Ayurveda. So I am not an Ayurvedic physician, but still I found this very interesting. As early as in 7th century CE, Vagbhata in his Ashtanga Hridaya has given these guidelines upon which a person will be disease free. He has to take wholesome diet and good conduct, treating all living beings equally, thinking twice before every action, speech, or even eating, and not overindulging in sensual pleasures, to have self-restraint, and then one who donates generously, whose mind is undisturbed by any situation, speaking truth, having patience. So these are good attributes a person should have to have a healthy life and have a disease-free life. There are a lot of it. When I read about this Ashtanga Hridaya in net, he has given how to brush your teeth, what are the tweaks that you can use, and more interesting was the contraindications for brushing, the contraindications for bathing. So even that is given in a whole complete detail in verses. One another verse from Ashtanga Hridaya says, one should not sneeze, laugh or yawn without closing his mouth. In another verse, he says one should not blow his nose except for forcing out the dirty excretion. Are these not relevant during these COVID times? Don't we have all the scriptures or the literature to rely upon? So I conclude. One more thing. We all know these terms, Argyam, Padyam, Achamaniyam. We would have heard this in the Shodasa Upacharam when we do puja to gods. But in previous days in our country, all the guests were also treated as gods, and they were done these 16 upacharas. Of these, the first three are Argyam, Padyam, Achamaniyam, which means giving water to wash hands, wash feet, and then drinking water. So we would have seen in so many Hindi as well as Tamil movies, as a person enters a house itself, he is being offered water. So that's how people did themselves as well as they treated gods. But nowadays in our apartments lifestyle, we have forgotten, we only see in movies or certain remnants being left over in our religious practices. So I conclude my thing by saying, let us practice holistic medicine. Let us not look down upon whatever is already in our scripture saying this is Ayurveda, this is Siddha. No, we have everything in our scriptures, in our own ancient tradition. Let us fall back on our ancient tradition and let us fight not only COVID, we will win COVID and also any new infections that are yet to come. Let us practice holistic medicine. Thank you for giving this opportunity.